Good afternoon, and thank you for joining us today for another AHA Leadership Dialogue discussion. It's great to be with you. I'm Joanne Conroy, CEO and President of Dartmouth Health, and currently the Chair of the American Hospital Association Board of Trustees. I look forward to our conversation today, and I'm delighted to have my colleague, Dr. Robert Brady, join us. Robert leads our anxiety disorder service at Dartmouth Hitchcock Medical Center. He originally trained at the University of Arkansas, where he earned his doctorate in clinical psychology, later doing some postdoctoral work with the VA, and has now been at Dartmouth here for almost 10 years. Robert, thank you for joining us.
Good to be with you, Joanne.
Our health system, along with many others across the country, is deeply committed to ensuring that our patients and our communities have access to full range of behavioral health services. This is especially important given our current environment when events from national news to personal challenges can really ratchet up an individual's anxiety. Coverage of wars, the recent assassination attempt of a candidate running for office, and various other headlines create anxiety for people across the country. That, on top of everyday stress that people are trying to manage, makes it all more important for our communities, our patients, our families, and our workforce to have the tools they need to identify and reduce stress and anxiety. This will improve both their physical as well as their psychological health. We know anxiety is actually quite common, and it's an issue for many people in all walks of life. Robert is going to answer a lot of questions for us about anxiety and the incidents and how we actually manage it as an individual and a community. But what I'd love to do is have Robert tell us a little bit about himself and how he actually got into this line of work, which for many people could be anxiety provoking in itself. Robert?
Yeah, sure. Thanks, Joanne. And as you mentioned earlier, I'm a clinical psychologist by training, and here at Dartmouth Health, I lead a specialty team in our anxiety disorder service. It's focused on the treatment and assessment of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, and specific phobias, along with OCD and PTSD. Now, my research goes a bit further than anxiety, so I'm really focused on applying implementation science methods to develop and evaluate brief psychosocial interventions that are delivered in non-traditional mental health settings, so that we're trying to increase access to care overall. But in terms of how I got more focused on the anxiety disorders, it is a little personal, and I like sharing this because it normalizes anxiety. But I remember being an extraordinarily socially anxious, socially fearful kid. And it wasn't until I learned through my own experience of kind of approaching the scary thing, seeing that nothing bad happened, that I really started kind of coming out of that shell and being less worried about embarrassing myself and really having a fuller life. So I'm a big believer in the value of exposure-based therapies. That's really what I specialize in my intervention. And ultimately, I just found anxiety to be, and still do, to be a fascinating problem that a lot of people struggle with.
Yeah, that's interesting. It's something that a lot of people can relate to. You're not the only one that gets anxious, before a social situation or before giving a talk or a presentation. It sometimes can be disabling. I can tell you when I used to do we used to do oral board exam practice sessions with our residents. And some of my brightest residents they were so anxious they couldn't talk and breathe at the same time. And, actually the practice sessions really helped them actually overcome their anxiety. So it was really less about their knowledge and more about how to really manage their own anxiety in the situation. Well, how prevalent is anxiety anyway across the general public? How many people would self-identify as having a challenge with it?
Sure. Well, I always like the question, how common is anxiety? Because if we just mean anxiety, the answer is it's 100% common. And I always tell people everybody is going to experience some level of anxiety on a daily or at the very least a weekly basis. And I would say anyone who says they're never anxious is not telling the truth. but if what you mean is, what's the prevalence of people who will go on to have really problematic anxiety, the sort that's going to prompt kind of seeking care or getting in the way of their life, then we're looking at approximately 30 to 35% of the U.S. based population, at least, meeting criteria for some anxiety disorder at some point over the course of life.
Now, what are the criteria for deciding whether you have just garden variety or human anxiety and anxiety that probably needs to be addressed?
So, without getting into the weeds of all the individual criteria for each anxiety disorder, we would say there are two kind of main defining features. Either the problem, the anxiety, is interfering in the person's life, or
Mhm.
it's substantially distressing personally to them, that either it's a problematic symptom or it's a painful symptom. But really, anytime that the anxiety has gotten so big that it's limiting life or limiting enjoyment of life, I think it's worthy of being treated at that point.
A lot of people would equate that to having a panic attack, but that's probably just one symptom that people experience, and probably a kind of an extreme one. You don't want to get it to the point where you actually experience that.
Right. And so panic attacks are very common to have over the course of life. And that's going to be different than panic disorder. When we have someone with a panic disorder, it means they're having recurrent panic attacks. And maybe most importantly, they're changing their life in some meaningful way. That is, they're stopping doing the things that give them pleasure, or they're not going to places that are important for them to complete their activities of daily living. That it's not the panic attack, but it's the anxious apprehension of panic and the change in life, all to prevent what is otherwise an unpleasant but actually harmless experience.
Now, there's certain segments that you've seen a significant increase in anxiety. I think we all kind of are worried about young adults and teenagers, but there are probably other segments of the population that are experiencing rising anxiety that we need to be aware of.
So I think it's a good question. What are the prevalence differences by segment or age group? I don't know. That's the kind of research we're looking back on in some ways. But I can say that two of the areas that we're kind of particularly concerned about, as you mentioned, are young adults. I'm not a young adult anymore, and I think it would be really tough to be one these days. When we think about anxiety as a perception of threat somewhere in space and time, that's how I think about anxiety. The danger is not there, but it might be in the future. I mean, kids right now, they're kind of drinking through a fire hose of cues for anxiety. They have a constant flow of information, and they can't predict anything. The moment one day, some part of themselves is acceptable and appreciated, and the next day it's not. It's something that has changed, and now they can't be that aspect of self anymore. So that would be a really hard place to be in. And certainly anyone who's a parent or knows other young folks is understandably concerned about the risk of increased anxiety in that population. The other end of that spectrum is our older adults. And so some folks listening to this may be aware of or familiar with the term anxious depression in older adults. And anxious depression is this sort of milling about presence of just discomfort. We've got end of life issues that we're starting to think about. We're having fewer folks in our lives because a fact of life is, as you get older, there's an increased likelihood of losing folks that are close to you, and so all those things compile along with trying to maintain that quality of life they're used to, while also going through the substantial change of retirement and changes in your living. So that results in a lot more of that anxious apprehension. That's another population we're particularly focused on.
And a topic that a lot of people talk about is the role of social media. And I can tell you that there are times that I just don't want to open up my news feed because I don't think it's going to be good. But we know that a lot of our younger patients are very tied into social media. And frankly, for some of our older patients, that is sometimes the only contact or stimulation they may have if they don't actually get out of their apartment or their home frequently enough to interact with others. So I know you probably have written many papers on the impact of social media, but how should we approach it as, aunts and uncles and parents with these younger kids who I think are significantly affected by it?
So a simple question we might ask someone in our clinic is this behavior helpful to you? On balance, is this thing, whatever it is you're doing, maybe it's accessing social media, is it making life better, or is it actually perhaps causing some problems? And we'll hold up the mirror, kind of figuratively, to say, this is what I heard you describing about your use of social media, and you said this is how it makes you feel, but I notice you're continuing it. Maybe this is functioning more as a habit or an effort to avoid something else. Maybe it's repeatedly trying to look for reassurance in the social media and not being able to learn to tolerate the uncertainty. So there's a lot. It's a very complex subject. It is not my content expertise, certainly, but it shows up almost ubiquitously in our population.
Yeah, it feels like sometimes a national event can actually get amplified by the number of times it actually shows up on social media and all the social media venues, and it almost makes it feel more impending for people that they could be affected by that.
Yeah, and so in some ways it becomes a numbers game, right? It's so omnipresent, it's so constant that you kind of say, well, it has to be important if they're putting it on the website this many times, right? Kind of failing to remember that the normal stuff of life doesn't make social media, right?
Yeah.
The normal stuff of life doesn't make the news. It's the scary stuff. And the more you see it, the more you start to say, it must be, this is something I have to be worried about.
Let's shift a little bit and talk about anxiety in healthcare workers. We have a lot of uncertainty and violence in the world that gets amplified by social media, but healthcare workers are often on the front line, either treating victims who are affected by violence, but also we have more violence within the healthcare setting. People are angrier. And, we can use the example of the active shooter that we had here almost 7 years ago that created a lot of anxiety within the organization. It felt like our safe little bubble of the Upper Valley had actually been popped, and people realize that we could be vulnerable.
So, right. And we oftentimes are the most anxious about the things that we can't predict, right? If anxiety, as I said before, is the perception of threat somewhere over the horizon, um, you know, ideally the salve, the balm for anxiety would be able to predict things, and those unpredictable events and the idea that they might happen, that's what provokes that anxious response. Um, you mentioned at the top that I've been here for about 10 years. And so I've been able to work with a lot of healthcare providers, both as colleagues, of course, but also sometimes in my clinical work. And healthcare providers come across as superheroes sometimes. And I think sometimes we also think of ourselves as superheroes, forgetting that if anxiety is a normal human response, we're going to have it too. And we try to kind of push that part away instead of kind of welcoming or accepting it and acknowledging it. The pandemic also certainly heightened that sense of anxiety, because here is an unpredictable event and we're being asked to do things where we don't feel like we have the same sense of control, and that starts to impact our resilience. So we're not superheroes, but we have the training, and ideally we have the support necessary to remind us that we can deal with even the unpredictable parts of the work.
It was really fascinating after the active shooter here that people surfaced with experiences before they came here. We found out we had 3 people that used to live in Sandy Hook, and our incident actually stirred up a lot of the kind of trauma that they were still kind of dealing with, as being proximate to that event. And it was fascinating that you would think that how proximate you were to the event had something to do with your anxiety level, but it had nothing to do with your anxiety level. It felt like it was almost a reflection of the other trauma you'd had in your life. How common is that? I was struck by that.
Sure. So we think about that as kind of trauma reminders. So, um, oftentimes someone goes through a terrible event and they say, I don't want to think about that anymore. They try to put it in a box and put it in the back of their mind. But all it takes is a little reminder to cause that to come back, to be thinking about that more. A lot of the work that we do in the anxiety disorder service at Dartmouth Health is with PTSD specifically, trying to help people understand and process the things that happened before. And we think, when you have something bad happen, if you say, I'm going to put that away, I'm not going to think about it anymore, you better hope that the way you were thinking about it when you locked it away, that was an effective way of thinking about it, that was adaptive. Because if you don't think about it anymore and you put it aside and say, I'm just not going to deal with that, well, you're kind of stuck with whatever thoughts and beliefs you had about it at the time. So then when a similar event happens, they didn't deal with the first one, and it makes understanding how this could happen again all the much more difficult.
Yeah. So what should we be doing as leaders of hospitals and healthcare systems to actually support our staff? At some point in my career, I thought everybody would benefit from sitting with us psychologists at least twice a year, almost check-ins. And I think we've actually even talked about that. We do that with our residents. We have a psychologist that's hired to support the residents. But that's probably undoable for some of our health systems. We have 18,000 employees across the health system. But what else should we be doing to help support our staff?
So I think this is a good point to note that most of our colleagues manage anxiety quite well. In fact, we actually did a study during COVID of healthcare workers and the resilience, and specifically with anxiety. And we found that the overwhelming majority of healthcare workers did not report anxiety that would be concerning, that would be in kind of the clinical range, or if they had a high anxiety, it went away within a year. But what that also showed is that almost a fifth of our colleagues do have, problematic anxiety. What we want to be able to do is help to identify the folks that are most at risk, because we don't want them to suffer in silence. We want to be able to promote normality of anxiety and to be able to talk about it. And one of the other things we learned from that study was when the healthcare workers can't predict day to day what's going to happen, or when they're asked to do services and tasks outside of their usual sense of what I can control and predict, their anxiety was much higher. So as leaders, I think what folks in healthcare want to be able to do is both encourage people by reminding them you have the training and skill set to do amazing things, and you can cope even with uncertainty, while at the same time trying to give them the most predictable working environment that they can, not unnecessarily inserting uncertainty, even if sometimes that's part of the job, trying to smooth out those rough edges of unpredictability. And if we talk a lot about encouraging psychological safety, and then other times people talk about brave spaces. I want to encourage people to create predictable spaces so that the person knows what to expect as much as possible from day to day.
That's probably the key to my success, because the same Joanne Conroy shows up every single day. I'm boring, but the same person shows up. One question about outside of the hospital, because we're healthcare providers, people look to us for advice and resources. Resources are tough around behavioral health services. The need really probably exceeds the available supply of people that are easily accessible. And I think it's worse out in the community. So number one, what are the signs that we need to look for in maybe our family members or our friends outside of work who deal with issues of life, job insecurity, health issues, family disruption for any number of reasons. But what are the signs that we should have our antenna up for that it may be a situation that would require a professional to get involved?
Yeah, so I won't say there's one sign or symptom, but a hallmark of problematic anxiety is the tendency to avoid or to escape from things that the person previously didn't avoid or escape from. So if you're noticing someone who is more withdrawn and less active in their usual activities, we oftentimes associate that with depression, but it's a huge feature of anxiety, no longer being willing to go to the and do the same things that the person once did before. Um, so similarly, increased use of substances where it didn't present a problem before may also be serving as a kind of a tricky form of avoidance. We don't necessarily think of it as an escape traditionally, but when you're using a substance all with the goal of managing emotion, it's very effective in the short term and potentially deadly and certainly very harmful in the long term. So increased avoidance of the usual parts of life the person was engaged in before, as well as increased rates of substance use would be two of the things that I would be on the lookout for.
Mm-hmm.
And it's important to keep in mind, simply asking someone, is this something that's worrying for you?
Mm-hmm.
Are you anxious? Are you feeling anxious about this, that, or the other thing? Is unlikely to get a negative response. It's showing that you're caring, that you're aware and thoughtful of how the person's doing. So I always encourage people, just ask. No one's going to get upset if you say, "Are you worried today?"
Yeah, yeah, that's a great suggestion. Um, you know what? I think our film history is filled with examples of people that use medications probably inappropriately, but ones that were historically associated with treating anxiety. My expectation is we probably are moving away from a lot of medication management and a lot more behavioral health management. But what is the state of the state in terms of the medication use for people that have significant anxiety?
Yeah, it's a good question. I think thankfully many of my, really most of my psychiatric colleagues and certainly our colleagues in primary care are less likely maybe than ever to prescribe benzodiazepines, short-acting anxiolytic medications that the goal there is to kind of prevent anxiety or to eliminate anxiety in the moment. But of course, that has some physical dependence problem, but a lot of behavioral or psychological dependence where
Mm-hmm.
the person's saying, I can't cope with, I can't go through this experience unless I have the medication on hand. And indeed, benzodiazepines are maybe the only medication that works while it's still in the bottle, right? Just simply the person knowing that it's there tends to be kind of anxiety preventing, but it has long-term negative consequences. And certainly some of the SSRIs and SNRIs are still a first-line treatment for anxiety. But as a colleague just earlier today, as a psychiatrist I work closely with said, the stuff that's learned in psychotherapy is more effective than anything else because it lasts a lifetime. It never really goes away. If you learn a skill or you learn from a helpful therapist who coaches you through approach of feared or anxiety provoking things, you learn in the long term that that is safe. You've learned safety. And really in treatment of anxiety, what we're oftentimes doing is helping people learn safety to inhibit previously learned associations of what's dangerous and trying to help people bust the myth that this, that, or the other thing might cause harm.
Yeah, yeah. People probably don't appreciate the fact that benzodiazepines are some of our most dangerous drugs in terms of withdrawal. And even compared to opioids and compared to alcohol, the withdrawal can actually has some serious kind of cardiac and events that can be associated with that. So it's amazing the kind of transition that we've gone through as a country, thinking that they were good for people, and then realizing that their best use is only sparingly and in very certain circumstances.
Right.
So, we all have some anxiety. What's your favorite thing that you do when you think you're going into a situation that could provoke anxiety?
So I'll give you two. The first is I take a perspective, I'm going to lean into the anxiety. I like that physical idea of leaning into the discomfort. Learning happens at the edges of discomfort. Feeling the maybe that sense of uncertainty and saying, can I feel this just a little bit more? And then on the back end, processing how it actually went. That's a really key thing. The other is reminding myself that almost all things are copable, meaning almost all things can be lived through and dealt with without catastrophic consequences. If most things that we encountered result in catastrophe, they would just become the norm and not outliers. And I like to remind myself of that. I can cope with just about anything. And I look back on my experience and can say that when I've leaned into the discomfort, I've coped with the outcome. And those are the strategies I typically take and what I encourage in others.
Yeah, no, that's great advice. And I would say that it's probably good to think about how do you kind of compose yourself before you walk into an anxiety-provoking situation, and then approaching it with really an inquisitive mind rather than being frightened by what may happen. So, and you're right, when you look back, most anxiety-provoking situations are much less anxious in retrospect than they are in prospective.
Yeah. What's the benefit of telling myself that I'm certain things are going to go poorly on something I'm about to do? It really doesn't make much sense to do that, and it doesn't help anything in the long run.
Yeah. Well, thank you. I want to thank you for joining me today, Robert. And I appreciate you sharing some of your valuable expertise and insight, and certainly some of your own personal insights in terms of managing anxiety. And I encourage all of our viewers to reflect on some of the advice that Dr. Brady has shared, whether managing individual anxiety or helping somebody get the assistance they need. Until next time, I want to thank everybody, and I look forward to seeing you next month at our Leadership Dialogue. Have a wonderful day.